About 3.5 million naira is spent monthly on diesel to power the generating set of the 68 Nigerian Army Reference Hospital. And this was revealed when the national president of the Nigerian Army Officers' Wives Association visited the hospital in Lagos. TVC News senior correspondent Ivy Kano reports, but would like to warn that this report contains scenes with flash photography.
The president arrived in company of her ESCO members. Before taking on a tour of the hospital, there was need to get the women acquainted with the activities of the hospital and also their challenges.
Ensuring 24 hours power availability. I hope we'll get to this point soon. The hospital spends close to 3.5 million every month on diesel and PMS. This we can use to do other things to improve the lot of the patient if Ministry of Defense will take up the temporary staff. The payment to temporary staff takes over 12 million naira every month for resources of the hospital. If they are submitted to the Ministry of Defense, this will also go into improving things generally in the hospital.
Then the wife of the Chief of Army Staff went straight to why she visited. The entourage visited the female ward, male surgical ward, the officers' ward and other wards in the hospital. The association said the visit is to identify with the sick.
Currently we're in a situation where there are several battlefronts in Nigeria, and this is where some of the patients come. So we felt we should come and see them, reach out to them, pray for them, and extend the warm greetings of the Chief of Army Staff. Subsequently, we're doing other outreach programs. We have a medical outreach in Buhari in the coming months.
She also revealed that she's very passionate about mental health issues, especially those of wives of army officers across the country.
The result of losing a loved one is it could fall into depression and other mentally related illnesses. We're very aware of that because obviously a lot of women have become widows as a result of what is going on in the Northeast. So the wellness center we're thinking of setting up in Abuja is basically to look at an environment where it's conducive for women to be able to go, women, men, children, anyone that feels that they need some counseling, some emotional support.
While commending the serene environment of the hospital, she said, with the kind of service provided by the hospital, Nigerians may not necessarily need to travel out for Medicare. Ivy Kano, TVC News, Lagos.